Welcome from the American Heart Association, American Stroke Association 2025 conference in Los Angeles. I'm Phil Gorelick, professor of neurology at Northwestern University in Chicago, Illinois. And today with me is Professor Huo from Beijing, China, who will be presenting a very important study on TNK and its usage in thrombectomy patients. Professor, could you tell us a little bit about the objectives of your important study, ANGEL-TNK?
Okay, thank you. I'm very happy to introduce my trial. The name is ANGEL-TNK. It's about the thrombectomy. Then we give the intra-arterial tenecteplase injection. We know that for the large vascular occlusion, even though we could do thrombectomy, open the artery, but the prognosis is not very good, very high. So we want to find a way to increase the good outcome of patients. So we start to this trial and to test whether intra-artery injection of tenecteplase after successful recanalization of the large vascular occlusion could increase the good outcome and whether it's safe, whether it will cause more or less symptomatic hemorrhage of the patients.
Okay, so as I understand it then, these were going to be patients who undergo mechanical thrombectomy, and then you're going to try to improve their outcomes further by an add-on therapy with tenecteplase.
Yeah, that's correct. The patients need to be do thrombectomy first, then they get successful recanalization. But the successful recanalization, the definition in the thrombectomy is a TK score. That means if you open more than half of the artery, it's success. So for these patients, still there are regions under ischemic area. So we need further to improve the blood supply of the brains. So we built up this trial to see if injection of tenecteplase could improve.
Room for improvement, that's
Yeah.
the goal here. Very good. So tell us a little bit about your methods, how many centers you had and how you went about this and how quickly you were able to recruit patients.
Yeah, this study started in the year 2023. We have 19 centers actively enroll patients, and the sample size is 256. In about no more than 2 years, we finished the trial and finished the follow-up of all these patients. So I come here to report the results.
Very good. So I'm sure our audience is waiting with bated breath to hear the main results. What were they?
Yeah, the results show that by successfully recanalization of the artery, for the intra-artery tenecteplase injection group, we could see a significant increase of the modified Rankin skin scale of 0 to 1 in 90 days. It's about 40% of this group. But for the control group, we gave no drugs. It's only 26% is positive. So
Okay, so
it
you
improved
have
outcome.
a nice additional improvement in these patients. And I think one of the points that we need to bring out is this was an intra-arterial injection. Is that correct?
Yeah, intra-arterial
Okay,
injection.
so with an intra-arterial infusion, I'm assuming then that this was done flawlessly by the endovascular interventionalist in the cath suite. So they did the procedure, and how soon after the procedure did they administer the intra-arterial tenecteplase?
Yes, it's very important because for not to increase the hemorrhage rate, we need a micro catheter and place this micro catheter to the distal point of middle cerebral artery in the fixed position to give injection. And the injection is very slow for more than 15 minutes, a long time to in case of hemorrhage transformation of basal ganglia. So we use the right dose, right position to avoid increased hemorrhage rate.
Was there any imaging done from of the brain parenchyma between the endovascular procedure and then the intra-arterial injection of TNK, or was that not done?
As one character for our child is that we need to follow up angiography after injection. And we see that after intra-artery tenecteplase injection, the arteries of ETK score increased after injection. So maybe by this method, we increase the patient's good outcome.
Okay, so you were relying on the Tiki score, a good Tiki
Yeah.
score, but there was no CT or MRI then
Oh,
that
we
were
have.
done before the
Oh,
intra-arterial injection of tenecteplase. Is that correct?
yeah, for this CT scan is optimized. You can do a combined CT by the DSA machine, and but you can also choose no to CT scan. You just
Okay, you can
have to
do it
select
either
one.
way.
Yeah,
Obviously, if you do it without the CT,
yeah,
you're going to get the injection done sooner.
yeah. But we have follow-up CT for 24 hours.
So tell us about the brain parenchyma, the brain tissue. What happened? Were there bleeds or
Yeah,
was it
and
safe?
for safety point, even though we use the half dose of tenecteplase, that is a little bit higher than other trials, but we didn't see any increased hemorrhage rate.
So that's good news.
Yeah, both
Very good news.
symptomatic and all hemorrhage, there's no increase.
All right. So maybe you can tie this all up together very quickly. What are your conclusions?
And in conclusion, is that for the highly selected patients, when we gave the injection of intra-artery tenecteplase after successful recanalization of large vascular occlusion of anterior circulation, we could see there's no increase of hemorrhage. And also for these kind of patients in ANGEL-TNK trial, we saw the higher rate of MRS 0 to 1. That means excellent result of patients compared to the control group. So it's benefits for patients.
Well, we congratulate you. An excellent add-on therapy that can help our patients improve even more. Just a question or two. How do you think this might influence the practice of acute stroke care in China?
Yes, even though we get the positive results, but it's a clinical trial. We excluded many patients and also have very strict inclusion criteria, not allowed to use intravenous thrombolysis and not allowed to use intravenous antiplatelets during the first 24 hours. So to get the final conclusion, still need more trials to prove it.
We need some reproducibility here,
Yeah, to make it,
additional study to validate what
yeah.
you've found. Okay, and I suspect then that that will also apply to the more global, worldwide stroke centers, that there's going to need to be further study about this. And finally, uh, what do you think are the advantages of tenecteplase?
I think it's easy to give only one blood injection, and also from many trials, I think it's safe. And also in China, it have more time windows for patients to use according to the reimburse for injection. So we like to use that in the future.
Okay, well, Professor, we congratulate you again. A wonderful study, and you've shown that we can improve care even more, which is great. I'm Phil Gorelick from the American Heart Association, American Stroke Association 2025 International Stroke Conference in Los Angeles. Thank you.